Food Allergies and Anaphylactic Response, Kearney R-1 School District. Food Allergy Basics. There is no cure for food allergies. Complete and strict avoidance of the food is the only way to prevent a reaction. The role of the immune system is to protect the body from germs and disease. A food allergy is an abnormal response of the immune system to a food protein. When the food is ingested, and in some cases merely touched, the immune system thinks the food is harmful and releases histamine and other chemicals to attack the enemy. 8 foods cause 90% of the allergic reactions in the United States. Milk, peanuts, eggs, tree nuts including walnuts, pecans, and coconuts, wheat, shellfish. Food allergy facts. 8% of the United States population, or approximately 5.9 million Americans under age 18, has a food allergy. That averages to approximately 2 children per classroom. Of these children, 38.7% have a life-threatening food allergy. Symptoms. 1 or more may occur shortly after eating the allergen. Trouble swallowing, shortness of breath, repetitive coughing, voice change, nausea or vomiting, diarrhea or abdominal cramping, swelling, hives, eczema, itchy red rash, drop in blood pressure, and eventually loss of consciousness and possibly death. Anaphylaxis is a serious allergic reaction that is rapid in onset and may cause death. Each year in the United States, anaphylaxis to food allergies causes an estimated 50,000 to 125,000 emergency room visits depending on the source. Individuals with a food allergy plus asthma are at greatest risk for a serious, life-threatening reaction. Prompt administration of epinephrine is key to surviving anaphylaxis. Prescribed as auto-injectors such as the EpiPen and the Twinject. Follow the 5 rights to medication administration and make sure you have the right student, the right time, the right dose, the right drug, and the right route.
Injecting yourself or others with the EpiPen auto-injector is as easy as 1, 2, 3. If there's an emergency, these 3 simple steps could save your life or someone else's. Hold the ergonomically designed EpiPen auto-injector in your hand and 1. Pull off the blue safety release, which will unlock the device. Now the EpiPen auto-injector is ready to use. A clear window shows if the pen has already been used. If the window is blocked, or if the device does not fit into the carrier, it should not be used. 2. Swing the EpiPen auto-injector into the outer thigh and push in the orange tip firmly until you hear it click. Hold it there for approximately 10 seconds to make sure all the medicine is delivered. 3. Get emergency medical attention right away. Take the EpiPen auto-injector with you to the hospital emergency room. There is no need for concern about an exposed needle since it is protected both before and after use. You'll also find easy-to-read instructions printed right on the EpiPen auto-injector. It's as simple as 1, 2, 3. Remember to always keep your EpiPen auto-injector close at hand to stay prepared.
Epinephrine works by relaxing the muscles in the airway and tightening the blood vessels. Common side effects seen are paleness, shakiness, anxiety, increased heart rate, headache, and nausea. All tolerable when you consider the alternative. If you suspect someone is having an allergic reaction to food, do not delay in giving the epinephrine. Most fatalities occur when epinephrine administration is withheld or even delayed. Basic principles. For the safety of the allergen students, total avoidance of food allergens. Make wise choices through vigilant label reading. Careful food preparation and cleanup with soap and water, not antibacterial hand gel or hand sanitizers, as these do not break down the food proteins. Always be prepared in case of a reaction. Managing food allergies in your school. 15% of children with food allergies attend school or are in a child care setting. Up to 25% of peanut and tree nut reactions in schools are first-time reactions. The majority of reactions in schools occur from foods in the classroom used in projects or celebrations with unintentional ingestion of known allergens. Those at greatest risk for death are students whom are allergic to peanut and tree nut, adolescents, and young adults. Those with additional diagnoses of asthmatic conditions, and when epinephrine administration is delayed or withheld. Sources of cross-contamination. Cross-contamination occurs when food proteins mix through direct or indirect contact. Food allergens can transfer via unclean hands or utensils, high chairs, tabletops, preparation surfaces, fryer vats, garnishes, and even saliva and pet licking. It only takes a single protein to cause an allergic reaction. Prevent cross-contamination and minimize the risk of a reaction by washing hands with soap and water after eating or handling food. Plan for safe parties and celebrations. Avoid using food as an incentive or for class projects. Prohibit food trading and sharing of utensils. Enforce allergen-free zones in your school and do not allow unsafe food to enter into any instructional or classroom setting. Familiarize yourself with students who have a food allergy. Vigilant label reading is key. Read every label every time. Don't rely on safe list. Formulations and processing can change without warning. Additionally, allergens can be found in non-food items such as soaps, shampoos, skin products, medications, lotions, and even pet food. Be careful handling items that may carry the food allergen proteins back to your students. If a reaction occurs, activate the student's food allergy action plan immediately. Each school health room staff will have an allergen kit for individual allergen students. Each kit will be stored in the health room, teacher's classroom, or carried with the student if applicable, and must be transported with the student on every off-campus event such as a field trip or music program. Each allergen kit includes individual action plan for the allergen student. Also included Benadryl or an antihistamine, epinephrine, physician's orders, student photo identification, and emergency contact information. Remember to recognize the symptoms, react quickly, and review what caused the reaction and how well the action plan worked. Once a reaction begins, there is no way to know how severe it will become. Take all food allergy-induced allergic reactions seriously. School is responsible for creating a safe environment for every student, including those with food allergies, and is obligated to address teasing and bullying behavior towards students with known food allergies. Remember these key points. Reactions can occur anywhere. Early recognition and treatment is imperative and life-saving. Review annually the district's food allergy and anaphylactic guidelines and allergy safe zones in your school. Always wash your hands with soap and water before and after handling or consuming food. Help keep our students safe.